Hello and welcome to the BIWAK podcast. My name's Sarah and
My name's Bob. Not the sharpest pencil in the box.
Welcome to BIWAK. It stands for
Brain injury. What a kerfuffle.
And the title was thought up by Bob because
That's what it feels like.
yeah, definitely.
Every day, that's what it feels like.
And as you can probably tell, this is our very first episode on the podcast. It's our introduction, and we have no idea what we're doing.
Let's be fair, it's our first ever anything podcast.
That's
not just on this one.
That's very true. And we're going to learn as we go. So we're starting off with audio only, but the intention is we will
very soon have it. You can see our faces as well.
Yeah, that means we have to have a wash. So we're starting off with audio first. So the intention behind the podcast is to share our experiences, isn't it?
Yes.
That we found ourselves in a situation where Bob has had 2 strokes. The first one 10 years ago, and obviously then I became his carer from that.
But one wasn't enough for me. I had to go and have another one.
You did. And what else did you have?
2 heart attacks.
And?
Heart surgery.
Correct. And now you have a bit of heart failure?
Yes.
Since the surgery or since the heart attacks? Yeah. You wanted to say a little bit about your voice?
Yes. I believe, anyway, it's my idea, that I used to have very nice, soft, gentle tones. I somehow feel I've been left with this. So I'm just going with it. Some of my words don't always come out properly, or sometimes I don't know what I'm even talking about.
Yeah, sometimes they don't come out at all, do they?
No, that's it. So bear with.
Yeah, and we've decided that we're not going to edit any stumbles or anything like that out of your speech, because that's who you are, isn't it? Or part of who you are.
What do they call it? Raw footage.
Raw footage, yeah. And also, Bob quite often asks me to explain things just because I do it a little bit more quickly. Yes. But I think part of the intention of the podcast is to give you something to do, something to look forward to, something to focus on, as well as hopefully help other people, isn't it? Who may be in a similar situation to us.
One of the thoughts I keep having is that a stroke is a stroke. It doesn't matter whether it's a stroke or whether it's a brain injury, anything that affects the brain. And everybody's different, so nobody has worse or better strokes. It's quite impersonal, and you just get on with it. That's what I say, get on with it.
Yeah, and at times it's been difficult to get on with it.
It's been quite difficult.
Yeah.
But because I've always had a very positive view on life, and I didn't lose that with the strokes. It's really that, and Sarah has got me through.
And other things which we will discuss in future episodes. Yes. Yeah. And our background, we're both nurses, retired. Yes. But also this is a disclaimer, because we're not here to give medical advice. We're not here to suggest anything for you. If you do want to make any changes to your medication, to your rehab regime, whatever, make sure you discuss that with your team, your doctor, nurses, whatever you've got, whoever you've got you're working with.
Can I just say on the other side of that?
Yeah.
We didn't do anything drastic. We just got on with it.
Yeah.
Really?
Yeah. And it can be hard to know what to do at the beginning. And you just do muddle through. So if you're at a point where you're just muddling through, just keep going. You're doing a grand job. You're doing fine.
Yes.
So we haven't really planned out. I've made a few scribbly notes here, but we haven't really planned out what to say other than.
Do you want to start with
your first stroke?
How I discovered I had a stroke?
Yeah.
We were happily rolling along, weren't we? And I was just retired. I was looking forward to have my fun. We were going to Tai Chi classes.
Yeah.
And in the morning of the class, I woke up with severe vertigo. And I could barely walk in a straight line, or straight even. Did the class. They gave me a chair, thankfully. Then we walked around to the shops, and I just had to sit down exhausted. Then we ended up going back to the doctors, didn't we?
Yeah, so when Bob had first had his vertigo, that wasn't on the day of the Tai Chi class, that was a few days before. And we'd been to the doctor, to the GP, hadn't we? And she'd given you some medication for vertigo and said if it doesn't get better, come back. But he was, walking around and coping, more or less okay. There was no signs that you see, like the fast signs at all, was there?
Yeah.
And then I think the Tai Chi class was maybe 4 days later.
Yeah.
We were having one-to-one sessions. Was it on the Friday?
Yeah, Friday.
Yeah. Yeah, because you never do anything. Like it would be a weekend, wouldn't it?
Yeah. So it was Monday when I saw her again.
Yeah. And, so we're back to the GP and then...
She got me to do one leg exercise, just one. She said, go to hospital.
Yeah, it was that. So she took you through some neurological examinations, which you passed all of them.
Yeah.
And then there was one you couldn't do. Correct. Well.
But apparently it's a classic sign of a brain injury.
So she said, I think you've had a stroke. And we said, both being nurses by background mind, we both said, no. No, we didn't have a stroke. So off we toddled to
our local hospital.
Yeah, the medical assessment ward, wasn't it? Luckily, we didn't have to go through A&E that time. And they sent you to the stroke ward, did they? You were overnight before you went to the stroke ward. I can't quite remember. It was a while ago.
Okay. Oh.
Yeah. But, Bob you were still walking, although be on one side, wasn't it? Because you were tilting over to the left, if I remember correctly, and having difficulty. Can you remember if you were still having vertigo symptoms at that point?
No, I wasn't. They'd passed.
Yeah. And then, because we live an hour away from our local hospital, Bob had asked the nurse if I could wait with him while he was waiting for his scan, and they said no. So off I toddled off to the canteen and was basically sitting at the end of the ward reading a book.
I went for an MRI.
Well, you went for your scan, yeah.
As they wheeled me back on the wall, she came out to me and said, I'll tell you what, I should pop in. Straight away I knew they'd found something.
Yeah.
She didn't have to tell me that they had. I just knew. So when the doctor came to see me, before they could say anything, so I've had a stroke, haven't I? So how do you know? How do you know? Well,
and while I was sitting at the end of the ward waiting for permission to go down to see him, I heard one of the doctors, they were going into the staff room, and I heard one of the doctors saying to the ward sister, how's that man walking? And I thought, that's my husband they're talking about. Yeah. Because
I didn't feel like I'd had a stroke. That's the honest truth.
Yeah.
So in one sense, I didn't have anything to worry about.
Yeah. Oh, and by the way, we're recording this in our lounge, and we've got 2 dogs, so you may well hear them moving around.
And a cat somewhere.
Cat's in bed. Yeah. But anyway,
And then the second.
So, well, I came down first. Let's focus on the first one first.
Okay.
Yeah. And then we'll do the second one.
Okay.
Because there's stuff to discuss in between, I think.
Yeah.
If that's okay.
I've been copped.
You've been copped. Yeah. Because otherwise the podcast will consist of 2 episodes.
Yeah.
And that'll be it.
Yeah.
So I came down the ward. They actually allowed me in outside of visiting towns. And as I approached the bed, you were giving one of your lectures to the doctor. I don't care what has happened in the past. You said, didn't you? I don't care what's happened in the past. What do I need to know to move forward? What can I do to, to recover from
I
it?
don't usually pontificate, but I was having it on that day.
He has his moments.
Yes.
As I have my moments.
Yeah. Did I mention a good sense of humour?
Essential.
Useful. Yes.
Essential, absolutely. So you were then seen by physio on the ward, who said,
because I was walking around, there was nothing they could offer me.
Yeah. Yeah.
Because he'd been observing me, and he said, I've never seen anybody like you. There's nothing I can offer you.
Yeah. Yeah. And when Bob got discharged, we didn't have any follow-up planned because he was too good for physio. Somehow we weren't referred to Stroke Association.
Local. To anybody.
Yeah, we had nothing. And I think the assumption was, and I think our assumption was as well, because we're both nurses, that we would know what to do. And I have to say that is not the reality of...
As it turned out.
Yeah.
But I think in the intervening period, it's been mentioned second stroke, we just took over actually. I didn't get... I mean, there were some changes, but it didn't get unmanageable.
Yeah. I mean, you could still walk. You were walking with a stick.
Yeah.
You had some weakness to your arm and leg, didn't you?
Yeah.
But that stroke had affected part of the pons area in the brain stem, and we'll talk about that again when we've done a bit more research on appropriate stuff to tell you. I don't think we can go into that right now, can we? But yeah, you were fatigued after the first stroke. You were having issues with fatigue.
Yeah.
And also there were some cognitive issues in...
That means thinking.
Yeah. Cognitive thinking. So some issues, but not massive.
No.
It was just there was something not quite right.
Yeah, my speech was all right, mostly.
Your speech was fine. Yeah, your speech was fine there. But I think it's difficult 10 years on to remember because so much has happened between the first stroke, the second stroke, the heart attacks and the heart surgery, and then the recovery from that. It's difficult to remember exactly what happened, isn't it, there? But basically, we had approached a colleague of mine who's a psychologist and asked if she knew of any neuropsychologists because you were having some difficulty with the fatigue and with the thinking. And she said, asked for a referral to the brain injury unit. And it never occurred to me, I have to say, that a stroke was a brain injury. I thought that the brain injury unit only dealt with people who had like a physical injury to the brain via like an accident. But of course, I've come to understand now that a blood clot to the brain or a bleed on the brain or a tumour on the brain is a physical injury.
Yes.
Yeah. Just in one that you can't see from the outside.
Yes.
Yeah. So we were waiting for referral for that, and it was about 18 months later that we actually got an appointment, and I think it was that week before that you actually had your second stroke.
Yes.
And that is where we're going to leave this episode.
Yes.
Because
it gets interesting. Yeah. Well, hopefully it's all been interesting.
Yeah.
Right, now the other thing is, I just want to say why we... I think it was my idea, wasn't it?
It was your idea.
My idea. And I thought it'd be nice, it'd be alright for me anyway, it'd be nice if we could share what had happened to help, for people to have an insight into somebody else's brain injury, but also give them, you, our viewing public, listening public, a chance to think maybe about what I'm losing
That's okay. Think about how their stroke's affecting them and how their caring situation's affecting them.
That's it. And maybe we will say something that will perhaps trigger something for you.
Yeah.
You know, I mean, I'm always going to be emphasizing the positivity. You have to be positive. You know, I'm very lucky and I've got a very supportive wife who I do get on her nerves. I know.
Yes,
I know
he
I
does
do.
get on my nerves, yeah.
But
he always has.
I always apologise. So I don't see any harm done, really.
And he knows it's not personal because everybody gets on my nerves.
Yeah, I'm going off track again.
It's because you started talking about me.
Yeah, I'm going off track again. Is there anything you want to add?
No. I think because we've not done this before, and normally we just rattle on for ages when we get into a conversation.
Yeah.
We're trying to keep these podcast episodes to about 15 to 20 minutes, mainly because I don't like podcasts that are too long, and also because Bob will be absolutely shattered after doing this.
Yes.
He gets very, very fatigued. So
very quickly.
Yeah. So the plan is we're going to try and do an episode a week. We will probably record 2 or 3 episodes pretty quickly, and then we'll try and do one every week. But, we might not. It just depends what's happening.
Can I ask you, if you enjoy it, if you get something out of it, would you be kind enough to pass it on, tell lots of people about it so they can... We're not getting paid for this. This is purely off our own back. So even if you tell 1,000 people, that's not 1,000 pennies for me. We just want to get the message out there. We listened to one from America, didn't we?
Yeah.
Which was made up of in a hospital.
We'll cover that.
Yeah.
In the next one, because that's when your speech was really affected.
Yeah.
So I think to give the speech issue its due, I think it needs a separate, more time than we've allocated for today.
Maybe even 2.
Yeah. So we've set up a Gmail account. If you want to email into us, it's BIWAK, BIWAK podcast@gmail.com. So if you do want to cover anything or share anything with us, like as time moves forward, we're hoping that we will. So what?
But they'll be able to share their experience.
Yeah, and maybe we'll even get people to come and talk to us about different things, because I've got some ideas about things that have helped us. Obviously, we're going to share them, and maybe we'll get some people in to talk about things as well.
Right now, we need your help to get this out as widely.
You sound like Bob Geldof.
Do I? Was I Irish?
No, but we just watched that Band-Aid program, and it was just
you
making
see what
me
I
laugh.
have to put up with. You see, don't you? What was I saying?
Basically, Bob really, really wants this to be successful. He doesn't want to sit here talking to me every week without other people helping him out and coming out on his side and saying, "Sarah, shut the heck up, whatever you're doing, let the man speak."
You didn't say, "Bob, shut the heck up." So,
are you happy?
I'm happy.
Okay, so we'll see you.
Or hear you, or us.
Yeah.
Or get emails from you.
Yeah.
Yeah.
And episode 2 will be talking about the second stroke.
Yeah. So what's that email again?
BIWAKpodcast@gmail.com.
Bye-bye.
Bye.